I'm Gina and I'm with PBS and I'm here at the University of Oklahoma to document some of the daily lives of some PA students here. I know they have some incoming freshmen that are going to come in and we'll be able to show you what some of the personalities are and what the daily life is. So I hope you guys enjoy. Okay, it looks like the majority of the students are on break, so let's go see if we can find a few and see what they're doing. So, here's one. Hi.
Hi.
Sam?
Yes.
Hi. So what are you doing on your break?
I'm actually waiting on the women's restroom.
Okay.
Hey Sam.
Hey Joe.
Legs fell asleep. Got new Flappy Bird record. So good luck on that one.
Excuse me.
Okay.
Okay, we are now here with Ashley, and she's going to tell us about her near-death experience in the anatomy lab. Ashley?
Okay, so it was toward the end of anatomy, and we were dissecting penises, and the instructions were to insert the probe into the urethra of the penis, and then cut down either side of it, and then open it up and check out what's going on. So I had followed the instructions, and I was trying to cut, but the skin was really tough, and I really couldn't cut the skin. It was dry, wrinkly penis and everything, and so I was trying really hard to cut it, and my scalpel slipped, and I sliced through my finger, and then blood was gushing everywhere, and I don't exactly like the sight of my own blood, so I thought I was going to faint, and my dental student partner ran off to find a teacher, and he comes over, and well, I was washing it off because penis juice was all in my finger wound, and he was like, just put a paper towel on it and put your glove back on, it'll be fine. And I showed him, and he was like, oh, you're going to need stitches. So we walked over to the Green Clinic, and he had to stitch me up with like nautical gauge wire because he didn't have anything else. And now I don't have any feeling in this side of my finger.
Oh, traumatized by penis.
Traumatized.
Okay.
Who was the person that?
Oh, Dr. Hodon. We're best friends now.
Okay, today we're going to see if we can get an interview from a PA student maybe, and I think they're on break, so we'll just go on in. Okay, I think the students are on break. They're in the line for the women's bathroom.
It's not too long.
No.
Oh my gosh. I take that back.
The women's bathroom line? Yeah, I like that color. Wow.
Oh my gosh.
Take a while. Well, since we're here today, I've heard some rumors about some students walking late for class, and I think we can probably have time for a quick story. Hi.
Hi.
I've heard rumors about students walking late for class. Can you elaborate any?
So one day, I can't do this.
You can talk about it. It's okay. The pain is over. Okay, Molly, now that we're alone, would you like to tell us what happened?
Yeah. So one day I woke up late and I was just snoozing, I guess, and I came an hour late to class and I was freaking out. So I was just like, man, I gotta get to class. And I opened the door, jet across, sit down, and then everyone's looking at me. Class stops for a while.
I'm sorry, did you walk in front of the professor?
Yeah, so I walked in front of the professor, which you should never do. Class ends, I go to the bathroom, I'm taking a piss, and McNeil walks up, knocks on the door, and he's like, hey, when you're done with that, come upstairs. So I went upstairs and got a talking to. So, moral of the story is, don't be late.
Don't be late and don't walk in front of the professor, apparently.
What did Dr. McNeil say exactly to you?
Upstairs?
Yes. Can it be said on camera?
I don't particularly remember, but he said something like, if you're ever late when you're actually on the job, the doctor's not going to have it and you're going to get fired or something like that, something along that line.
Oh, okay.
But then he said again, don't ever walk in front of a lecturer and have it like a dumbass.
Okay.
Well, yeah. Thanks, Molly.
Thanks,
Yeah,
Molly,
you're welcome.
and get back to class.
I will.
Okay, well, it looks like all the students are out of class and on break right now, so I think they use their free time to study, so we're going to go see if we can find a few in a study group. And I've heard rumors of this thing called a penny thrower, which is a know-it-all that likes to throw out information that nobody needs to know and sound really smart. So we're going to go see if we can find one today. So, let's look in here. Looks like we got a good group in here.
Do you guys want to talk through this stuff? Oh, I love talking.
Yeah. Let's try that. Okay, I have a question. Okay, somebody has carpal tunnel. What nerve is affected?
Median.
Okay, that's right. Okay.
Oh, I got one. What causes winged scapula? Damage to the long thoracic.
Yeah, that's right. Give somebody else a chance. You got a question, Smarty Pants?
I've actually prepared a few relevant questions. Stab wound to the chest. Injuries to the intercostobrachial nerve. Which condition results from this lesion?
Is that
Your patient's dying.
is that honest test?
Yeah, dude, did we learn that?
I am just trying to make you better practitioners. You don't learn for a test, you learn to treat patients.
All right.
Okay.
Yeah.
What else?
It's loss of sensory fibers to the second intercostal nerve.
Okay.
Good to know.
Okay. Anybody else got a question?
Yeah, I've got one. What happens if you damage the radial nerve?
Wrist drop.
Good. Okay. Okay.
I'll give y'all a chance.
Thanks. Okay, I've got a question. If somebody has de Quervain's tenosynovitis and you want to test for that, what is that test called?
I just studied this.
You go like this.
What?
Finkelstein?
Oh, yeah.
All right.
What it is.
Someone studied.
Okay.
Okay, crush injury to the little finger. Name 3 muscles that would be affected.
Okay, that's not even on the test.
Dude, why would you even ask something like
It's
that?
relevant to your life.
You're stressing me out.
Yeah,
I gotta go.
I'm trying to prepare you for
Sorry.
life. I'm trying to prepare you for life. Boo. I guess we all know who's going to be the better practitioner.
Okay, I'm here with Nate today and talking with him about what he did before he started PA school and what his life was like. So, Nate, can you tell me what you did before PA school?
Yeah, prior to PA school, I was a high school chemistry teacher.
Okay.
And I got diagnosed with cancer.
I'm so sorry.
Oh, it's all right. I got well taken care of. I quit my teaching job and met a former student of mine and got started in cooking meth.
Meth.
Yeah, meth.
Okay.
You know, we became huge, made millions of dollars. Had to have my wife start opening car washes to launder our money.
Launder your money.
Yes.
Okay.
I eventually got so big as a drug lord that we ran out the cartels.
Wait, hang on. Is this the plot to Breaking Bad? Gina, this is the plot to Breaking Bad. This is a fake story. Gina, come on, let's get out of here. Let's go.
Wait. I've got another.
So the students are in class right now, and I think the lecturer just stepped out. So we're gonna go in and see what some of their study habits are during lecture. I hear some of the girls even shop online, so we're gonna go see if we can find this.
Hello, I have package for paid degree well.
Okay, we're here with Rachel. Rachel, can you just give us a truth about PA school?
Well, I would say before June 3rd, 2013, I took pride in how I looked. I liked to put on a cute outfit, do my hair. Ever since then, it's a top knot and elastic waistband pants every single day. And the best part though, is I can go to the gym on a very rare long break that we have at lunch and not even shower and come back and not worry about it because nobody else around me showered either. And I think I heard some crazy rumor that somebody in our class washed their hair in the sink.
Okay, we're here with Cassidy. And Cassidy, I know there's lots of positive aspects of PA school, but can you tell us some of your lower points that you've had?
Well, I've had a few. So I'm a little bit embarrassed by it, but in a way I'm kind of proud. I've slept here.
Here?
Yeah, on campus. More than once, less than 5 times as of right now, but that could change. And one of my more just really embarrassing moments was one of the weeks we had like 3 or 4 tests, like just crazy. It slept like 20 hours in 6 days or something ridiculous. I washed my hair in the sink here on campus. Not in that bathroom, it's by the PA classroom, but I can't tell all my secrets. But
oh, okay, yeah.
Yeah.
But in the sink?
Yeah, because I was like, well, I'm probably going to sleep here tonight because it was like late, like 3 in the morning, like I had to be back at 7. I'm like, my hair's kind of oily. I'm like, well, might as well wash it.
Yeah. Okay.
So.
We're here with Shelly Collins today, a professor in the PA program, and she's allowed us to document a day in the life in clinic with her. And we've got authorization to film one of her patient interactions with a fellow PA student. So we're going to go in and watch it happen.
Hi, Ashley. Nice to see you again.
Good
Haven't
to see
seen you
you
since GU lecture yesterday.
I know, and it's got me thinking. I think
Okay.
I've got some symptoms. Well, first, to start with, I've been having some weird eye things. Well, I've always had it. I can't wink my right eye. Do you think that could be like a cranial nerve tumor or retinoblastoma, something like that?
Well, what do you mean by you can't wink it?
Like, I can only kind of wink my left eye, and it's like I have to scrunch my whole face. And then if I try and wink my right eye, like nothing happens. Like
Can
I'm
you show
trying.
me
I'm,
what
try-
you-
I'm trying.
Okay.
That's all that happens. Nothing happens.
Okay.
What could that be?
Well, I'm not sure. What else has been going on?
Okay, I have to pee every 30 minutes, all the
Okay.
time. Urinary frequency. So I've kind of been thinking of a differential diagnosis here.
Mm-hmm.
First off, diabetes. I have to
Okay.
pee all the time, always very thirsty. Maybe neurogenic bladder,
All right.
bladder cancer.
Okay.
So I'm just saying, mostly the diabetes, I think, though. I think that's my main, that's what I think it probably is. And I've checked my blood sugar a few times. It's always been normal, but I think those are falsely lowered or something. And they're from the, Walgreens, $5. How accurate can it be?
Okay.
So there's that. And then my capillary refill, basically non-existent. My peripheral vasculature is just disintegrating, right, as we speak.
Okay.
I tried that Feinstein, whatever that filament thing for your feet, and I could feel it, but I could see myself doing it. So did I feel it, or did I just see myself doing it and think I felt it?
Okay.
So, I'm just worried. I'm one toe step away from, an amputation.
Okay.
don't know.
Well, tell me more about the urinary symptoms.
Okay, well, I have to pee all the time, and then sometimes I get to the bathroom, and then I don't actually have to pee. Like, I just thought I had to pee.
Okay.
And I heard you talking yesterday in your GU lecture. I was kind of zoning out a little bit, but I heard you talking about BPH, and my symptoms kind of sounded similar to that.
Okay.
Do you think that's a possibility?
Have you had any erectile dysfunction?
Shelly, don't be silly. I don't have a penis.
Okay. Whew. All right.
Let's not get crazy.
Okay.
Also, I think I have a heart murmur.
How did you find this?
Well, it happens maybe 3 times a week. And this is what it feels like to me. It feels like my valve is just going, and then it gets stuck, and it flutters, and it comes back down, and it's normal again.
And you can feel this happening in your chest? Okay.
Yeah.
Okay. Well.
So murmur, tumor, diabetes.
This is a
I know.
very good differential.
Yeah.
Pretty extensive at this point.
Mm-hmm.
What do you think we should do about this? How should we proceed?
I'm thinking maybe a full body CT. Just, to be on the safe side, just to check for any tumors, malignancies, things like that. Probably complete metabolic panel, just do some blood tests just to make sure. And even if nothing's wrong, it'll just give us a good baseline in case anything does happen. we know where I was at to begin with.
Right.
You know.
Okay. All right, I'm going to step out for a second.
Okay.
And discuss this
just digest
with
my
students.
ailments because I know there are a lot.
Okay.
So you just think about that.
Okay.
I'll see you in class tomorrow.
All right, I'll be right back in. Nice to see you. Okay, so basically what we have here is a classic case of PA student hypochondria. Very, very common in the spring semester when things get a little bit crazy. So basically the only treatment she needs is high-dose Xanax and all of her ills will be cured.
Okay, so just hypochondriac needs Xanax.
Right.
Okay, thank you.
You're welcome.
Okay, we're back here with Nate, and he said he's going to tell me what he actually did before PA school. I really want to know, it's really important. So what did you actually do before PA school started?
Okay, before PA school started, I was a sheriff
Okay.
in a small town in Georgia.
Mm-hmm.
And I was shot in the line of duty.
I'm sorry.
No, it's okay. Turned out all right. So I wake up in the hospital one day. Just, I don't even know how long it's been, but I wake up, everybody is gone.
Oh no.
So I, pull out my IV and start walking around, and I can't find anybody. So I walk outside, and everything is a mess. Cars turned over, things are burning, and so I start wandering around the city, and zombies.
All right, that's it. That is The Walking Dead. You are not telling me the truth. Turn it off. Okay, we're here and we're gonna talk to Alex today about learning experience.
Hold on. Are you gonna like change my name and blur my face so the kids don't know who it is?
Yes.
Okay, thank God.
About learning experiences that he's had through PA school. So, Mr. X?
Well, I mean, first of all, I wouldn't call all of them learning experiences because you're forced to do some of them. You don't get a choice. You read a lot in textbooks in undergrad and here, and you read about things, but some of the things you just don't believe truly exist. You want to believe that they're just a myth. And the story I'm talking about today started in the morning, and I went in to see Bruna, and Bruna answered the door, and she has that smile, that smile that just says, everything is gonna be fine, everything is gonna be great, you're gonna do great, but I wasn't feeling it. We stood in the corner and we practiced a little before it was time to I just need you all to know before starting this program that some myths are real, some myths are alive. Vaginas are real. Vaginas are here. They're here, and you are going to have to touch one. I'm sorry.
Hey Sam, I hit level 31. 31? Yeah.
He's like 48.
Alright.
That's cute.
I think I got some more in me. I think we can keep on going.
Yeah, well, 5 more minutes.
Alright.